Good morning, everyone. Thank you for joining. During my State of the School address in January, we asked the audience what inspires them and what parts of the school's mission resonate the most. The responses were telling. A remarkable number of you pointed to research as central to why you identify with CU Anschutz. Research is not peripheral to who we are. In fact, it is who we are and central to how we advance our mission, attract top talent, and improve healthcare in Colorado and far beyond. It's clear we're carrying strong momentum forward from the latest Blue Ridge rankings. The School of Medicine received its highest ranking in 20 years. This is huge. And we continue to boost our standings, with half of our 18 clinical departments now landing in the top 15. We're number 8 among public medical schools, and I believe we are well positioned to realize our vision of being top 10 in 10 among all medical schools in the country. In fact, I'm confident we can reach that goal even sooner, as several of our departments made meaningful gains this year, and many are just one grant away from being top 10. These rankings reflect the extraordinary work of our faculty, our trainees, research staff, and administrative teams. However, we do recognize that this is a complex and evolving moment for academic medical research nationally. Many in our community understandably have questions about funding stability, review timelines, and policy shifts. Today, I want to offer reassurance. Grants are in fact being funded. Awards are moving forward, and Congress has reinforced the expectation that applications be reviewed in a timely manner. Interestingly, signed into law last month, the fiscal year 2026 appropriation bill that funds the Department of Health and Human Services includes more than a $400 million increase for the NIH. This appropriation bill also preserves key programs at the CDC, HRSA, and SAM-HSA. Congress also protected institutions like ours from uniform caps on reimbursement for the real costs of conducting federally funded research, an important signal, I believe, of continued support for the research enterprise. Although there are some positives to look for in the appropriations bill, we are committed to continue to follow all the actions of the administration, ensuring that they follow the law and quickly and robustly fund extramural research programs. School leadership remains actively engaged, advocating for sustained federal investment and ensuring that our faculty and our research mission are well positioned to succeed. As your dean, I believe in transparency, clarity, and direct dialogue. So I am here today because research is one of our most important missions. But I also wanted to structure today's town hall as an open conversation with research leaders to answer your questions. I feel it's important that you hear directly from those who guide our research strategy and operations. It's also why I've asked members of my leadership team to take a visible role in these forums going forward. You deserve direct access to the people I've called upon to shape our priorities, navigate these challenges, and build upon the research arm of our mission. With that, I'm pleased to introduce Dr. Vineet Chopra, Executive Vice Dean for Clinical Affairs, Research and Quality, who will moderate today's discussion. Vineet brings a national perspective and deep institutional knowledge to this conversation. We're also joined by Dr. Leslie Berg and Dr. Adit Ginde, who lead our biomedical and clinical research efforts and will speak directly to those issues. Vineet, with that, I'll turn it over to you.
John, thank you very much, and
Thank
you for your leadership over the past year. I know you and I have talked a lot about some of the challenges that we faced.
It's been a challenging time.
And I just want to say I appreciate all the support and trust you have given us as leaders in the School of Medicine for the research mission. I'd also like to start by acknowledging what you said in terms of the times and how researchers are feeling. I know I hear this in my department as well. And even though the news is much better than we had initially feared, I do say that many of our investigators are feeling quite unsettled.
Right.
There has been uncertainty about indirect costs and funding. We've instituted several measures, including hiring and travel chills, that further caused more uncertainty. We've had disruptions to the NIH cycle where reviewers and grant sort of submitters don't know where they are with their process right now. But to your point, I think we responded fairly well. We increased our bridge funding to support our investigators. I'm proud to say that I know we lost very few people in all of this compared to other institutions.
You gained some too.
We gained some too, exactly. We created a new mechanism to support many of our investigators who are doing disparities research, who were actually particularly hit by some of the policy changes as well, creating new mechanisms to fund canceled grants. So, John, I remember your call was to reframe the challenge as an opportunity, and I'm really proud to say that I think we did just that. Our message was simple. We focus on doing good science. We write strong grants. In fact, I think we submitted more grants last year than any previous year of our research fiscal cycles.
We did, and I want to appreciate the fortitude of our researchers for doing that in the context when it might have seemed like a worthless effort.
Yeah, I mean, it really was a leap of hope, to your point, right?
But it'll position us well going forward.
It will. And then the thing that I think we really thought about is how do we change this into a sort of an opportunity? So we focused a lot on strategic recruitments, strategic retentions, and as you said, the results really speak for themselves. Still, as we look ahead, I want to acknowledge that we continue to navigate uncertainty. We have to be fiscally responsible given the environment that we're in. We have to steward our resources with care. And I think at the same time, we have to support our investigators during key career stages and strengthen the cross-domain collaboration across our science areas as well. So we're going to talk a lot more about this today and appreciate all of you being here. We're actually introducing a new structure for our town hall today. I'll first begin by introducing our two senior associate deans. We'll discuss their work and their activities. We'll ask them some challenging questions. I'll then actually move forward and ask questions that you sent in that we have ahead of time. But today also, we'll be taking live questions. So our team here will be monitoring the feed and the chat. So as you hear things and have interest, please do put in your questions. They will queue them up for us as we go along, and we'll do our best to get to them as we move forward. Sound good?
Sounds good.
So with that, let's talk to our SAADs of research. Adit, Leslie, welcome. It's good to have you here on this town hall.
Great to be here.
Yep.
I'd love you to sort of share maybe a little bit about your backgrounds and why you came into this role so that the audience can get to know you a little bit better.
All right. Yeah, so I'm Leslie Berg. I'm actually currently the chair of the Immunology and Microbiology Department, as well as being Senior Associate Dean for Biomedical Research. So I came to CU Anschutz in 2019 and took on the role as department chair, and just when Dean Sampson appointed some leadership individuals, I got appointed as Senior Associate Dean. And I think that those 6-ish years of being department chair after I moved here was my first experience being a department chair, really taught me a lot about how to shepherd a research enterprise in the right direction, and to, sort of understand a little bit about the dynamics of people and how to encourage people to buy into a unified vision that we have in the department about what is needed to be done, to sort of break down some of the silos that are typically seen in academic, at least basic science departments, where people feel that their activities are all their own work, their own accomplishments. They deserve complete control over their research activities, and there's funding and spending. And, some of what we need now, which now translates, I think, broadly to the School of Medicine, is to have a bit more of a shared vision and a bit more of an idea that we all buy into the collective good, and it's not necessarily your own personal good, but the collective good, and that benefits everyone. So that was my learning experience as department chair, and now I think the goal is to figure out how to kind of implement those sorts of strategies more broadly in the School of Medicine.
That's terrific, Leslie, and I certainly resonate with that. The connectivity among people makes us better as we do research.
Yeah, and I would add that, if we're going to get to top 10, all boats have to rise, but they can't rise unless we all work together to bring them to the top. So that's a great point, Leslie.
Adit, tell us about yourself.
Yeah, John, Vineet, Leslie, great to be here with you in this town hall. Look forward to the tough questions, maybe punting back some tough questions as well. And good morning, everyone. Thanks for joining this town hall as well. My name's Adit Ginde. It's really an honor to serve as Senior Associate Dean for Clinical Research for the school and for all of you faculty, staff, and contributors to the School of Medicine. I'm going to give a little bit of background as well. Similar to Leslie, my role as Senior Associate Dean is informed by my prior work as faculty here and as a faculty leader. So I've been faculty in the Department of Emergency Medicine for the past 19 years. So I've seen this campus grow and change over time and realize the promise from the 90s and the early 2000s in terms of clinical research and education missions. My clinical practice is as an emergency medicine physician in the emergency department right across the street here at UC Health. And that's, I think, important in a couple ways. We live in the emergency department at the fulcrum of outpatient and inpatient care, and really on a daily basis interface with basically every clinical specialty in the house and in our community. And so I think that background lends itself nicely to a broad perspective at the school level. The other thing I would say, and when the dean introduces me sometimes, he'll talk about bringing rocket fuel to clinical trials. And I think that's based on sort of a background in this clinical specialty where we really think about things in terms of seconds and minutes and not necessarily weeks and months. And so, infusing that energy and focus into clinical research and clinical trials is what I hope to do as part of this role. I'm also a practicing clinical trialist as well, which I think is important to do what you are also leading. And so, our group does acute and critical care clinical trials. And so, when things are going well, which there are many things going well, we know it and we can support and champion. And when there's opportunities for improvement, we are also the first to experience. We're right there with all of you, the research faculty, the research staff, administrators, and then now with this new platform, have the ability to try to make change at a school and a campus level as well. And then finally, as an administrator, just like Leslie, not as a chair, but as a vice chair in emergency medicine, really led quite a bit of growth in our research mission, focused on clinical trials. And we've seen an increase of tenfold in funding in the department, largely clinical trials. Also helped with, as the director of clinical research for anesthesiology. So, know what it takes to administer and grow the research program and hope to bring that perspective as well to the school.
I love how both of you talked about your backgrounds and your authentic selves and how you bring that to these new roles in everything you do and how you think about it. And I also love this concept of scaling, because you all talked about taking what you've done, but now bringing it at the school level. We created these two new roles, right? There used to be one Senior Associate Dean for Research. And one may wonder that why did we do that? And so I'd love your perspectives on why we created this sort of splitting between biomedical research and clinical trials.
Yeah, I'll start with this one. So there's just, frankly, a lot of ground to cover. There is our discovery science and basic sciences, and there's a tremendous need and opportunity there as well. And then in clinical research and clinical trials, as we'll talk about today, there is tremendous opportunity, new opportunities with federal funding and also with industry partnerships. And so having these two roles allows us, with our unique backgrounds, we have very different backgrounds in basic science and immunology and in clinical care and clinical research. We could really focus the needed attention on these two areas. And we both kind of have the same approach and vision. We want to solve problems. We are inherently impatient in terms of wanting to get to the work. So this is not about keeping the lights on. We have to keep the lights on. We got to keep things going. And then there are many important things that we can address together. And so then, we can, in our lanes and together as a research office, do that.
I'll add, part of the reason why there's two of you is because I want each of you to be laser focused on what we're doing, right? So when it comes to clinical trials, I appreciate very much how you've worked with and engaged Vice Chancellor Flagg and working together to correct these things. But to be clear, in this public forum, your mission is to just blow up roadblocks or bottlenecks to getting clinical trials done. and to be laser focused on every single step of clinical trial execution so that we can be one of the top places in the nation. And I know you've taken that charge on and working with Tom to really do that and have already made great progress. A new dashboard that shows where everything is in the steps in the process of getting this done. But part of the reason for having two of them is that's a massive charge.
Yeah.
And I want it to be a laser focus for us because I want to be the best in the nation in this area.
Well said, John. Leslie, what about your thoughts on this sort of dual role?
I think,
And feel free to disagree with it if you want. You're allowed to do that.
yeah, actually, remarkably, we disagree very rarely. But, and really that was what I was going to point out, is that, he covered all the sort of logistical and practical aspects of having two people shepherding the research enterprise, and the responsibilities for each of us are really separate and very distinct and very, as Dean Sampson said, I absolutely know what I'm supposed to be doing and what problems I'm supposed to be solving. There's no doubt about that. But I think the other thing is it's really nice to have a peer who's someone you respect, whose perspective and thoughts on things. What I've learned in various leadership roles is that most of being a leader is about managing people, and solving problems usually means managing people that are either causing problems or need to change the way they're used to doing things. And so having someone to bounce those critical discussions off of and to learn, I think Adit has amazing skills in that area, people management. He's just got this inherent sort of calm tactfulness, and so I've really enjoyed learning from him and sort of getting his thoughts about when there's a difficult problem to navigate, what his advice is. And Vineet as well. I mean, Vineet is the master at this, but he's really busy. And so Adit and I spend a lot more time together talking about these things because I can't always, run to Vineet.
But I will say, when
every...
the three of us meet and talk about stuff, it's actually a lot of fun because I like to learn from both of you as well. So this sort of cross-pollination, supporting each other and learning from each other, I think has really been, in my opinion, kind of magical. So thank you both for that.
Yeah, I
as
appreciate
well.
it. I had one statement to Leslie's, which is actually having the unique background helps so much because it's a completely fresh eyes. When I bring a clinical research or clinical trials challenge to the table, it's great to have Vineet's support and leadership as well. Leslie comes from a completely open perspective, and so can just look at things, think and act directly. That's, one of Leslie's secret sauces in terms of no beating around the bush, just getting to the point. Well, what I'm seeing is this. And so I think that's really, really valuable.
I like that idea too of it's a complementary creativity, right? And so I think that having these two roles has really upped the game for both of the things that you point out, Leslie, that we're just trying to solve, right? But we're not solving them in the old ways because the old ways aren't working. So we're solving them in new and creative ways. So I appreciate both of you engaging in some of the challenges that you have that are maybe different from each other.
So both of you have distinct research portfolios. We heard that. You're really focused in your areas as well. Let's unpack that a little bit. Leslie, you oversee biomedical research. Tell us a little bit more about your vision in the biomedical research space and some of your priorities you have as you think about this work.
Yeah. So I think, Dean Sampson, when he chose me for this role, we discussed a lot about what the practical priorities are. And I think they were really significantly focused on infrastructure for one thing. So for example, there are 60, 70 research cores around the campus and School of Medicine, and they are, there's nobody minding the shop as far as I can tell. They're just doing their own thing, and some of them need subsidies from the School of Medicine, some of them don't, some of them are, completely autonomous and self-sufficient. But I think that there's a need to sort of take a look at that whole landscape and think about how we might make sure that we're using our resources to the most efficient ways. Where are the big needs for the School of Medicine to infuse resources into a core facility, for example, expensive equipment or whatever it is. Where are the redundancies that we can eliminate? So that's a big job. We're kind of we're in the middle, in the weeds of doing that. The other big one, of course, was space, which I think we'll talk about
So you said
in a few minutes.
Because I was going to go there, but you went there before I did.
Yeah,
Great.
we can talk about that in more detail in a few minutes. But you know that as many people have heard me say, because we've been meeting with each department and center to talk about their spaces, there is no empty space. Mm-hmm. We're out. So all the growth that we anticipate and that we've heard Dean Sampson allude to is the goal of the institution, that has to be accommodated in our current research space. Mm-hmm. So that's another big responsibility. And then I think the third one is the one that's a little, in some ways the most fun part, but also the least defined. And that is trying to think about the future of the biomedical research enterprise on the campus and how to build on our strengths. I think we've all heard Dean Sampson talk about he's not a believer in peanut butter spreading the
I have heard that.
Oh.
Just for the record, yeah.
Yes, he just told my
Not
faculty
against
that.
peanut butter.
But we can't spread the resources evenly everywhere because that doesn't really accomplish a huge amount. But it has to be a bit more selective. And so engaging with all the different department chairs, the research areas, trying to kind of identify where are our strengths and how do we build on those to become really, top-notch in a handful of things rather than being, slightly above average in everything. And so that's, a big part of what we think
That sounds
about.
like a full-time job, just based on what I'm hearing. You have cores, you have space, and then should we call this multiplicative synergies in the areas where we can really do better and bigger things?
Yeah, absolutely.
That's awesome.
A couple of additions there, Vineet. On the cores, even last week we invested several $100,000 in one of the cores. So we want to invest in cores, but some of our cores are outdated, and some of our cores are insufficient. So what we want to do is look broadly at our cores to make sure we're providing the resources that our researchers need and sunset ones that they're not using or that they don't need, right? When it comes to space, it's always a tricky problem, and it's not a four-letter word, but it might as well be in the research community. But when I look at and try to predict what we need to do to get to top 10 overall, we need to grow our research programs 10 to 20% a year, and I'm committed to doing that. I'm committed to investing in our researchers to do that. But we're also going to have to work with our space. And that doesn't necessarily mean less space. It could mean that we modify space or renovate space, right? So we have to take this creative approach to make sure that our researchers are supported financially, supported with the space they need and the resources and the cores they need.
Adit, I'll turn it over to you. You've got the clinical research portfolio. How are you thinking about this in terms of your vision and your work?
Yeah, definitely. So when Dean Sampson selected me for this position, it was very clear he wanted me to go to sleep dreaming about how we can make clinical trials better.
Wait, you sleep? Really?
Yeah, no sleeping. Dreaming, those couple hours of sleep about it, and then wake up ready to go on this challenge. And so I've embraced that charge. For those that get emails from me at midnight or 4 o'clock in the morning, you probably experience it. Don't expect a reply. One thing is that, the dean said, you don't need to be top 10 in 10 for clinical trials. And I'm like, oh, okay, that's a little strange. No, we can have the opportunity here to be top 3 or top 5 in clinical trials, maybe in 3 to 5 years. And so that's the vision and the approach and the urgency that we're taking this. So why clinical trials in particular as a focus? One thing, clearly sponsors are moving in this direction. NIH, other federal sponsors, and a lot of opportunities with industry partnerships, because we're trying to get research closer to impacting clinical care. The discovery science work critically important for the innovation that drives clinical trials. And some of those last miles are really driven by the clinical trials and ultimately getting regulatory approval. So we have that opportunity, and the impact that we're making is we're changing the lives of patients in our community. in the clinical trials, we're delivering clinical care, we're giving access to cutting edge treatments and care and processes, and at the same time we're learning how to do this. So that's what we're trying to do, the how component of it. So first, how do we get to being a great institution and school for clinical trials? First, we have to be an outstanding site. Hands down, that is what is sort of the building blocks of being nationally recognized. So what does that mean in detail? That means we've got to start clinical trials quickly. We got to be first out of the gates. We've got to be desirable to be part of clinical trials and these cutting edge treatments. And then we need to enroll patients, and that is a key part of it. It doesn't help us if we start trials quickly and we don't enroll well. So I want to see us becoming the leaders across all of our trials when we look, and in our own clinical trials portfolio, there's dashboards around who's the leading sites, and our teams look at it very carefully. We want to see University of Colorado at the top or near the top whenever possible in those, because that showing prominence also means that we're delivering these trials to our patients. And then we take that notoriety, and then how do we become leaders? It's our own science, as it is with everything else. So that starts with investigator-initiated trials. So those are our own ideas, sometimes coming out of discovery science, sometimes coming out of clinical observations. And so we come up with our new ideas, and we facilitate the ability to implement these unique ideas, get funding, federal and other sponsors for those ideas. And then when we get to the point of being seen as leaders, we already have some good examples of multi-site trials, but there are tremendous opportunities to lead not only at our own site, but nationally and globally in these trials, where we coordinate and lead. Some of that is data science, some of that is the clinical expertise, and some of it is the regulatory expertise. We have some really good examples, and we can scale that for sure. In terms of getting to, say, top 10 and 10 for NIH funding, this is a tremendous opportunity. Because these are large awards that get credited to the school and to University of Colorado. And then for industry partnerships, they are thirsting for these institutions that want to lean in and want to lead trials. And so that's where we're going.
I think that one of the things you're alluding to, and I really appreciate how you've engaged Mark Banaka and CPC, because that's one of the jewels in our crown here with their expertise. You refer to the international and national trials. And the other thing that's super important to me on our campus is our cancer center. We're looking now for a new cancer center director, and with the infusion of dollars from the school into that group and from our partners at UC Health, I think we have a great opportunity to recruit a fantastic cancer center director and show how much we value our cancer center on our campus. And you interfacing with the cancer center and with CPC is part of how that interconnectedness really, I think, will leverage us being a very attractive site for clinical trials.
Absolutely. I think, the Cancer Center and oncology research is a key building block, and we actually learn a lot together in our conversations. There are, things that the Cancer Center are pushing that we can hop on, help, and then those lessons learned help the rest of our portfolio and campus. And then as far as CPC and Mark Banaka, a tremendous resource. As you've said, they have a wonderful track record leading multi-site clinical trials nationally and globally. And so working very closely with Mark and their leadership around how to take those, again, it's all about scalability. Yeah. So how do we bring that to the rest of the school and the campus across even more content areas?
So I want to go back to the two roles, and clearly you guys have very focused areas that you're working on. But I've heard from other folks what we have two roles. Are we inadvertently maybe creating silos or actually creating spaces where we're not coordinating some of our efforts? I know we've talked about that, but I think our viewers would like to hear how we're working to not have this happen from both of you.
Well, I can start on that one, and Adit can jump in. So probably it's become apparent that we work great together as a team.
Yeah.
So I think that helps a lot. But there's a lot of overlap, I think, in the two areas where there are projects or activities that really impact both of them. So one of them is, for example, biobanking, biorepositories on campus. So that's a critical feature for all basic translational science, and it's also really critical for the clinical trials operation that we have really top-notch, efficient biobanking. Another one is data science. You know, we're living in a world that changes seems to be monthly in terms of the technologies available, but data science is critical for discovery research, for translational research, for everything, clinical research, I mean, if you don't have strong data science and data infrastructure, we're going to be left behind, right? So I think we see these areas of overlap, and we don't try to duplicate our efforts, but we sort of decide, okay, one of us will really take the lead on this, but every time I have an email about something to do with biobanking, I CC Adit on there. So knows exactly what I'm doing, who I'm talking to, and he's probably annoyed by all the bombarding of the inbox.
No. Yeah.
But I think we really make an effort, and when he works on clinical trials or your program, to the Ascend program or others, he CCs me. So even though I'm not necessarily in the room and participating in every meeting and every conversation, I'm aware of what's going on, so that when we get together, we don't need to fill in all the background. We can immediately talk about, all right, how do we go to the next step? What do we need to do next? What's going on? What's the plan? And I think that's largely because we do work really well together in
Terrific.
partnership, and we have a wonderful bridge between us, Sarah Steed, who's our director, and she's part of everything. And so, in fact, when we each meet with her individually, she can also fill me in sometimes on what's going on with the DIS projects and vice versa.
And Sarah is the director of the research office, is
Yes.
that right? Okay.
And I just want to call it, she's been fantastic. I mean, we've talked a little bit, and people know that there's the data that we want to do research on, but there's also management data, and that's a big thing for me. And Sarah's been great getting data so we can look at our space, right? And we can see how some of our departments have actually optimized their use of space over the past year. So I just want to call her out. She's been fantastic.
I'll add to that as well. I think Sarah has been a unifying force for our office in her ability with data, but also finance and administration. We can't do anything that we wish to do without her and her team helping to support as the director and dealing with finance and administration issues. So I think she's one. I think Vineet, you're another one. We come together, the three of us, formally every week or two, but daily. And so you can help provide not only kind of unifying forces for us, but also synergize across missions as well, because, a lot of work that we do is intermixed. So that's great as well. The rest of the leadership team, Shanta, Naresh, and others. And I'll just echo, it's a great synergistic and stylistic match. We're not creating silos because we are constantly in communication. And we do that because we share the vision. This is a service role. We don't care about the credit that we're getting for this. We care about fixing problems together. And so we're here in service of the school and of the faculty and staff. And so then it's, do you want to take this one? Oh, actually, I have a little more time. I'm happy to pick this one up, especially because, as Leslie said, so much is in the middle. And then we just keep each other updated. We're constantly communicating, meeting, and again, to echo the prior comments and our unique backgrounds, we can just bring fresh perspectives to issues that have been potentially longstanding challenges.
That's great, and I love the way you guys work together. I have to say, it's been a lot of fun. We could talk forever, but I can't believe we're actually almost halfway through this town hall. So we're going to go ahead now and go to the viewer questions, or the questions we received ahead of time, just so that we can get to some of those. I think the first one I want to sort of focus on, the big one, is around the federal climate. And how are we going to sort of think about how we manage our research enterprise, just given all of the challenges we're having in federal funding policy? I know we've talked a lot about it, but maybe the both of you could talk a little bit about this as well.
Yeah, no, sounds good. So, I think there's clearly been changes, and I think as mentioned in the opening statements, the uncertainty is really what is causing tumult amongst our teams. I think we're really proud of how we've responded as a school and how our teams have responded by continuing to apply. So the funding is out there, the funding exists. We need to be aware of the changing priorities and help to navigate that for sure. We also need to diversify our funding portfolios. It's always been important. It's especially important right now. And just because we look to other federal sponsors other than NIH or industry does not mean we can't pivot back and forth. And in fact, it's quite synergistic. So try to encourage and promote those opportunities is really important. And as was mentioned in one of your opening comments, specific changes like in health disparities, we've leaned in heavily. Want to call out Lily Cervantes, Department of Medicine, for helping to lead our committee, our grant committee, to come up with a process for the school and the campus to help to continue this line of research. If we're looking at differences, disparities, single demographic groups, we have technical support, we have rubric that's helpful in navigating the federal funding climate. It's also helpful for how we approach non-federal awards as well. And that's been adopted by the campus, and I think is a concrete example of sort of how we leaned into these issues.
Leslie, what about research infrastructure, given all the changes happening right now? How are we going to prioritize what programs we invest in, how we avoid duplication, and how do we, back to John's comment about top 10 and 10, how do we maximize impact of those investments?
Yeah. Well, I think, there's a couple of things. One is, as probably most people know, there are a number of School of Medicine supported funding programs for faculty. Some of them are for, bridge funding for people that are temporarily experiencing funding dips in their portfolio. Some are for people who are close to getting that R1, but, just need a little bit of help getting the last bit of data, things like that. I think the other part of it is, certainly I don't have the content expertise to evaluate every component, like all the research cores and all their different activities and specialties. So one of the things that we're working on now is for some of the big, kind of what I think of the big ticket item cores, the cores that have a lot of very expensive technology and support a lot of people across the entire school and campus, is to get some external advisors from other institutions who have that content expertise and are presumably not biased one way or the other, to come in and evaluate our cores and tell us, are they serving the functions that they need to be serving? Are they providing this high quality services to people? Do they have the equipment that's up to date and state of the art to provide the data that people need for their research? And then, to ask those, talk to users, talk in particular to people who choose not to use a core. So those are the people, if you're out there in the audience, I implore people to step up and volunteer to talk to the external reviewers and when about why they might choose to go elsewhere, use a commercial vendor or whatever instead of one of our research cores, because I think that is really important information, that probably the hardest part to get. And then we will take their recommendations and come up with a proposal for the dean about, this is the support that this set of cores needs. These two should be merged. We're working with the School of Pharmacy, which also has one of the structural cores that's kind of redundant with one in the School of Medicine.
I see.
They're going to be part of the process, the external review process, and Blake Hill, who's the chair of pharmaceutical sciences, is really enthusiastic about participating together with us in this, so that we get a really clear vision about what's needed, how do we support it, and do the best for our research
Leslie, I love
community.
that idea of working across the schools, right? One of the real strengths of this campus is we have a School of Public Health, we have a College of Nursing, we have, a School of Pharmacy, all that are in and of their own right top ranked. And I think we have not sort of even scratched the surface on leveraging that. The other thing that I think it's important to mention, we're talking, and this is a research town hall, but we're talking about investing in our researchers. And I just wanted to call out, our clinicians every day work extremely hard. And CU Medicine and our work with Children's, UC Health, National Jewish, Denver Health, even the VA, our clinical enterprise has grown 10% a year. It's been incredible year after year after year, and that gives us the resources. So just a shout out, in this context of a research discussion, to our hardworking clinicians and also our team at CU Medicine, the finance team, the contracting team, who make that possible for us. So shout out to them as well.
Well,
here
and
today.
to your point, John, having these clinical partnerships allows us to be able to do studies and research across the enterprise, right? So when we think of
Not just here on
multi-center,
this campus,
right? We think of multi-center studies, we're
Our
thinking about
community
clinical
doctors
trials.
as well.
We're engaging Denver Health, we're engaging the VA and National Jewish, and so that makes us more attractive, I think, to sort of funders, if you like.
That's right. Core to the mission of these academic academic hospital partners, and the ability to implement across this broad footprint is really unique to our enterprise for sure.
So speaking of clinical trials, I'm going to finish this thought if I don't mind. We got a lot of questions about clinical trials and the challenges with sort of startups and the timelines. And frankly, people I heard were frustrated that it takes too long for us to get things off the ground. Funders come and say, well, it's going to take you X number of days. Maybe this is not a site for us. That does not sound compatible with the vision that I think John has set us out on. I know you've been working on this, Adit. How do we approach this challenge?
Absolutely. Really important question. Appreciate the questions in advance and the discussion on this over the past year. We cannot simply be competitive without improving our startup timeline. So first, how do we get there? We have to measure it. We have to measure it comprehensively. As the Dean mentioned, we've developed a life cycle clinical trial dashboard, which looks from start to finish across all processes. We've had different dashboards for this, but nothing that unifies. So this is a unifying process that includes accruals and includes finances as well. But there's, at least 25 steps in the clinical trial startup process. So first, process mapping it is actually not an easy endeavor. Then it's measuring each of these steps and then assigning metrics and benchmarks to it. So that's what we've done. That's the approach we've taken. It's not an easy task. Then looking first at the process, what can be done in parallel versus serially. We may have done things serially, but everything that is a serial process is lengthening our timeline. So there are some opportunities that we're focused on the process component of it. Then it's the how on each of the benchmarks and metrics. And, if you look at this, this is it's an alignment activity. There are different parts of the process. When you look at them each individually, many of them are actually doing quite well. And I'll call out, a few entities in terms of thinking about alignment. So first, at a campus level, you mentioned Vice Chancellor Flagg and the Office of the Vice Chancellor for Research. Tremendous opportunity or tremendous activity in those areas in terms of the startup timelines, the encore teams, contracting. And each of those IRB, they're actually going quite well. Our hospital partners, as we mentioned, really important. Daily communication also, UC Health leadership under Gene Kuttner and Lori Bloomberg Romero. We're really bringing together, this is not an us and them thing. This is clearly a we activity. You can feel that energy, and it takes time to see the results of this, and we're starting to see the earliest signs of these metrics improving. But really it starts with how we partner. Same thing with Children's, Ron Sokol, Janae Neiman, and the leadership team there. CCHRI, really incredible infrastructure. And so we're partnering with them as well. As you mentioned, Denver Health. They have a new chief academic officer, Yael Schenker. We've already started to meet. How do we, infuse clinical trials there as well? Similar conversations with National Jewish and the VA. So it's really about partnerships, and then the core of the research teams. The research teams are doing the daily, activities. Those are the faculty. It's also the coordinator staff and administrators as well are key parts. We want to bring this all together. And so we focus on various parts. In any moment, there could be one part that is a delay, and that can prevent us from achieving our overall goal of opening a trial because all of these steps are necessary. So right now, we're focusing on parts of the startup timeline related to Encore. We've done work in the calendar space. We're doing work in the Medicare coverage analysis space in partnership with UC Health and our hospital partners to address and staff up those things so we can get to where we want to be. But we also don't want to be solving issues one at a time, because then something else, may be challenging. So we're already looking at other parts of the process, using dashboard data and other metrics to say, what can we anticipate will be, potentially a barrier or a roadblock in the future, and starting to address those as well.
So give me a prognosis on this, Adit. Like, when do you think we'll be at a place where we're like, oh, I think we're finally now back in the game? Is it 6 months? Is it 12 months? What is it looking like from a timeline perspective?
Yeah, I think we're already starting to see, in the current stage, it's sort of the Encore open to accrual pipeline related to, the handoff from calendars to Medicare coverage analysis, I think is what many in our community are experiencing. So again,
that's the backlog that we're
yeah, we're working daily with Gene Kuttner and Lori Bloom-Guerrero, Marissa Macri and that team. The staffing has been approved. I think there's recognition from leadership at the school level and at UC Health, for example, in this case, that this must be addressed. We have to be competitive in this area. There's already approval for staffing. Staffing has been hired, more than doubling of the teams, actually, to be able to get there. Wow. It's a 6 to 9 month training process that's in process. But we're already starting to see, a balancing of the numbers coming in versus the numbers completed, getting to even. And I think in this next month or two, we're going to start to see that flip, where we're going to dig out from our queue. And it's going to take, another 3 to 6 months to, clear the queue and get to where we want to be. But we're also recognizing that in that time period, there are individual projects in area, cancer center trials. There's the cancer center renewal application coming up in the next year. So we're also doing focused activities. There's also a partnership we just met yesterday around how the CU team, the calendar builder team, who also does coverage analysis for CU studies at CU clinics and CU medicine, can help out as well. So everyone's rolling up their sleeves to solve these problems together, not it's an us and you problem. We are all in the same boat together, and we're trying to achieve the same
That's
goals.
key, Adit, and I just want to call it out, because by mapping that process, we could see where the bottlenecks were, right? And my charge to you was to fix every bottleneck, and when the next one pops up, fix that one, and every part of the process needs to be quicker. But what you've been successful at in identifying and working with our partners, particularly at UC Health initially, to see where there was an issue. And I just want to call out, the support from Jean and her team up through, Rich Zane, Tom Gronow, Liz Concordia, to not only address these issues, provide psychological support, and also provide financial support to make our campus better. So it's not an us and them thing. And I think at times it can seem that way, but what you have been able to do by building that sort of process map is figure out how we work together to get from A to Z. And I just think that's been really the right path, and it's going to make great opportunities for us going forward.
Yeah, I appreciate that. I think it's about trust and alignment of goals, and I think we're there.
Absolutely.
And so we're all rolling up our sleeves together, from leadership down to the managers and the doers as well.
Great.
We're going to pivot and ask it a live question now from the audience. So Jamie Stutz actually put one in. Thanks, Jamie, for the question. So Jamie asks, can you address how T3 and T4 translational science is being shepherded and supported by leadership? So maybe, Adit, I'll have you start with that, thinking through sort of more of the health services, the clinical research, clinical trials.
Yeah, I think a critically important area for our school and our campus. We're fortunate to have really tremendous resources and expertise. So, we have the CCTSI under the leadership of Ron Sokol and Janine Higgins, which really focuses on the translational spectrum and has opportunities in dissemination and implementation science and expertise cores there, community engagement cores. They're really fundamental to doing this work. So we're championing, supporting, working with those teams. In the school, there's Accords, a key entity and critically important to supporting this work. So Jerica Berg and her team really building out this infrastructure to be able to already existing. We're partnering with how we can expand this work. What do they need to support this work in our faculty? And there's already tremendous synergy and collaboration across departments with Accords, for example, and executing this work and pushing it forward. So I think the future is really bright. And then health disparities is one that's come up a lot in T3 and T4 work. especially as we think about our community and our populations. And so, as we mentioned before, that's been an area of focus of how we can keep that work going with the changing federal priorities. And I think that's been a success as well.
Well, I love the fact that you have a role in CCTSI. You're very active in Accords. Just a shout out to Dr. Berg, who I met with yesterday. I don't know if you knew this, Dean Sampson, but Accords is ranked number 6 on campus in terms of research dollars. And just thinking about what they do in terms of nurturing and building our faculty, it's incredible. So great call out there.
Yeah.
I call it there as well. We have another question. Again, clinical trials today. It seems to be the flavor. Does your team have goals with other schools on campus for trials and investigator-initiated grants? And I think we talked about this a little bit, but maybe I'll turn it back to both of you for sort of investigator-initiated grants across other schools on campus.
Yeah, no, I think we haven't been able to talk about our role in the School of Medicine with schools and colleges on campus. We've done a lot, actually. Both of us have been meeting with the leadership, the deans, the associate deans for research of schools across campus on how we can synergize. And in clinical trials, definitely conversations with the School of Public Health, for example, with Kathy Bradley and Donna DeBelia, as well as entities like Biostatistics, Dave Conti and Nicole Carlson and their teams. There's a lot of opportunity in data science and public health in the T3, T4 space for synergy between our faculty and teams and the School of Public Health. Had meetings with the new dean of School of Pharmacy, Brian Suchi, and their dean, Associate Dean Manisha Patel. How do we synergize there? The tremendous expertise in the School of Pharmacy on pharmacokinetics. We've talked about phase 1 trials and our industry partnership conversations, and also just the expertise. We had tremendous, whether they're hospital pharmacy employees or school of pharmacy, it's actually a tremendous wealth of knowledge and resource, especially for our medication-oriented clinical research and trials, to be able to bring that expertise in. And then the others as well, similarly, nursing, dental, medicine.
I'll give a shout out to our new Dean of Pharmacy. We've met a couple of times. He brings an incredible amount of energy to this. And he himself is an incredibly accomplished researcher in doing these sort of cross PI, cross-institutional, cross-school grants. And most of our conversations have been about that, which will really leverage our campus, right? Having a leader like that there will be a tremendous asset for us in the School of Medicine as well.
Yeah, I love this more broad view on things. This is great, and I'm so glad that you're actually connecting with these folks as well.
I think one of the
Can I add one
Yeah.
thing to
Yeah,
that?
of course,
I think
Leslie.
the other aspect the School of Pharmacy really brings is in the drug discovery arena. So, for the more basic science, translational science researchers, that they're really interested in sort of, I would say, beefing up their activities there and providing that service. I have people in my department who sometimes come and say, well, I have this target bacterial protein, which I think if I could inhibit it, would be an antibiotic, or it would be, affect some skin disorder or something. Where do I go? And the School of Pharmacy has, a drug screening facility, and I think that from my conversations with Blake Hill and the dean, they're really thinking about trying to figure out how to make it more accessible and affordable for the research faculty to really make use of those. Because I think that back to the pipeline, you need new new compounds, new targets, new drugs, new things coming through the pipeline that will ultimately lead to the clinical research and clinical
I
trials.
just want to add one more thing to this conversation, which is sometimes we have structural barriers that kind of make silos between, in this case, schools. And I think it's been really inspiring, the conversations around we will be better together. How do we make sure that we look after each other in a team science approach? So to not have credit or how indirects get distributed be the driving factor. The driving factor is how do we advance together within our schools and use and utilize the unique skills that exist on our campus across the schools to advance the School of Medicine in this case and advance all of our campus partners.
I know that that kind of cross-collaboration, that kind of all boats rising advancement across the schools is a key priority for our new provost, Laura Borgelt. She's really focused on how the schools can work better together, and that's been a charge of mine from our chancellor from day one. So I'm glad to see that this is sort of coming to fruition.
It's terrific. I mean, I also love the fact that we're thinking about this more globally, looking at redundancies, looking at synergies, looking at how we can multiply effects. And it seems like the chemistry and the people are the right mindset now as well. Well, I feel like we could go on talking for a long time about this.
It's been a great interchange.
It's been a great exchange, and it's hard to believe we're almost at time. But I just want to basically close by thanking all of you for sharing your thoughts. I will also say I've seen the hard work you guys do at all hours of the day and night, and it's just a privilege and honor to work with both of you. And John, thank you for the opportunity to be here today to share what we're doing. It's a challenging time for biomedical research and for clinical research, but I honestly feel I'm very excited and I'm very optimistic that the foundations here, the structures here, the vision here, the passion that you all have just sets us up as best as I see it in terms of our future. So with that, maybe John, I'll turn it back to you for some closing thoughts, and thank you everyone for allowing us to be here.
Sure. I mean, it's great to have been here today, and I appreciate sort of the honest, open, authentic responses, the interchange. I'm absolutely confident in our leadership team in this area. So Vineet, Leslie, Adit, thank you for being here and for sharing your perspectives. Thanks to everyone also who submitted thoughtful questions in advance or those that came in online. Those that we didn't get to, we'll address in another forum. These conversations are important because our research community, again, is one of our greatest assets for our school. And as we move forward, your help and input helps guide how we focus our efforts and invest our resources. For those of you online, you'll see a QR code on the screen, and I'd really encourage you to take a moment to scan that and complete a short survey for us. We really do value your impact. This particular town hall was a result of that impact and a result of the survey that we did at the State of the School. So we try to be responsive in that regard. You know, despite the complexities of the broader environment in which we're working, I think there's just a tremendous amount to be optimistic about, particularly here at CU Anschutz. The momentum we're seeing in our research programs, the leadership that we have in place, and the dedication of this community give me tremendous confidence that we are headed in the right direction. So thanks to those online, thanks to those here with me today for being here and for helping to advance discovery in all of our different aspects on this campus. Thank you.
Thanks, John.
Thank you.